Athletes that have to bear a lot of heavy weight or force through their lumbosacral spine tend to develop a lot of back problems. Rugby, especially forwards, judo, cricketers, because they have to arch their back a lot. But really all sports, because in this day and age, through strength and conditioning and through the athlete's use of heavy weights, then practically all athletes are being exposed to heavy forces through their lumbosacral region.
So one of the big movement patterns that we see associated with our bad backs, or I guess our more athletic backs in the clinic, when we start seeing athletes dropping into this big extension pattern with their back or an anterior tilt of the pelvis. Big drop forwards, we get everything kind of really kicking in here through the lower back, and it's a movement pattern we really need to change. It's one we do see associated with a number of other injuries as well. First thing we need to do before we can start training it though is to make sure the athlete is able to have some kind of correction. So Dave's quite good here, so he's able to drop into his anterior tilted position and then get that belt buckle pointing up out the window. And that's the first thing we have to do with any athlete that comes in with their back sort of presenting with that sort of pattern. Okay, we can get them rocking back onto the heels, and we get the muscles in here just doing a lot less work. So we'll see guys sort of cued into that anterior tilt to try and lock the back in extension. And we come through a very, if you sit back into that squat now, okay, we come into, it kind of reinforces that very extended low back position. Okay, so that's a pattern that quite often we need to undo. And it's something for one reason we've started stripping away the back squats from a lot of the programs that we set, particularly for our rehabbing athletes. We start looking first of all at a box squat, okay, and really focusing on what's going on at the pelvis. So Dave, if you just step to the side and just pick up that box there. Get the thumbs onto the collarbone, okay, like that, elbows pointing straight ahead. And the reason we're getting that is it's going to help the athlete stay more upright, so we're not going to get into a big kind of hip flexion pattern. And then we're going to get that belt buckle up to the horizon. There we go. So we need to get locked in that position beforehand, and then we can tense the stomach. We'll lock that in place, and then we sit back into our squat. Good, and then back up. Once the athlete is able to pick up that movement pattern, then we can move into loaded exercises. So probably our go-to one to work on while we're controlling that pelvic position is our goblet squat. So if you want to have a crack with that then, Dave. And we're going to hold that position as we go back all the way to the box, and then weights on the heels all the way back up. So the aim of using these exercises initially is first of all to groove the movement, to make sure that becomes the movement pattern for that athlete, and that's the way they're going to stay when they're changing direction and playing their sport, in order to start looking after that back a little bit more. But it's to kind of embed some of these techniques in the gym, so when they go to their other programs or their other exercises, we can kind of cross this movement pattern over. That way it's got more chance of sticking with them, and we reduce the load on the back in the long term.
That surgery would involve coming into hospital for approximately 24 hours, undergoing general anaesthetic for a period of about an hour and a half, and then using a small incision. We would then go down onto the bone of the back, nibble away a tiny portion of the bone of the back to allow us into the spinal canal. Then using a microscope, we'd visualize both the nerve root that's being irritated and the prolapsed or slipped disc that's causing the irritation, and remove that portion of the disc. In the next few months, and certainly in the next 12 months in the sports surgery clinic, we're going to start to use endoscopes. The great advantage of this particular endoscopic approach would be that the patient would be operated on whilst awake. The incision would only be a few millimeters in size, and the patient could actually go home the same day. We normally advise a period of about 6 weeks after the present surgery, just to allow the skin to heal, the muscles to heal, and the patient themselves to get over the surgery. At the 6-week mark, then we do advise a graded return over the following 6 weeks to full contact.